Gentlemen, let me begin with a direct and honest question, and I invite you to answer it openly in the comments. After the age of 60, do your erections still feel as firm, reliable, and predictable as they once did? Or have you found yourself quietly adapting, avoiding the topic, and telling yourself that nothing has really changed? You can simply write yes or no. No explanations are necessary. What matters is that you understand you are not alone. And yes, I do read every single comment. If you are over 60 and you want to restore erectile strength, improve circulation, and regain a sense of male vitality and confidence, stay with me for the next few minutes. My name is Dr. Laura Miller. I am a board-certified urologist with more than a decade of clinical experience, and I work with men every day who want their bodies to function more reliably, comfortably, and confidently as they age. Today, I want to share a simple, science-based 3-minute daily exercise that can meaningfully improve erection quality in a natural and sustainable way, without medication, without supplements, and without unrealistic promises. This is not a conversation about shortcuts or quick fixes. It is not about so-called miracle solutions. It is about understanding how the male body actually functions after 60, and how targeted, intelligent habits can help you take control again. Before we continue, please take a moment to like this video. Doing so helps this channel reach men who need medically accurate, practical information that is still discussed far too quietly and far too rarely. Over the course of my clinical career, I have observed one consistent truth. A man's confidence is deeply connected to his physical health, and sexual function plays a central role in that relationship. While changes in erection quality with age are common, they are not something men are biologically required to accept without question. Many men experience frustration, embarrassment, or silent anxiety as erections become weaker, less predictable, or more difficult to maintain. If that sounds familiar, I want to be very clear. This does not mean your body has failed you, and it certainly does not mean there are no effective options available. Erectile function depends on the coordinated interaction of several systems: cardiovascular health, blood pressure regulation, glucose metabolism, nerve signaling, hormonal balance, psychological stress, and even the side effects of certain medications. Because of this complexity, improvement rarely comes from addressing only one factor in isolation. However, today I want to focus on one foundational element of male sexual health that is often overlooked, even in medical discussions: the pelvic floor muscles. These muscles form an internal support structure that stabilizes the pelvis, assists with bladder control, and plays a decisive role in erection firmness and endurance. When trained correctly, they help regulate blood flow, improve neuromuscular coordination, and support the mechanisms that allow an erection to remain firm. It is important to be precise here. This approach is not about increasing anatomical size. No exercise can do that. Instead, it is about optimizing the efficiency, reliability, and control of the erectile response your body is already capable of producing. The exercise I am referring to is commonly known as a Kegel exercise. Although Kegels are often associated with women, particularly in the context of postpartum recovery, they are equally important for men, especially as they move into their 50s and 60s. The first and most important step is learning to identify the correct muscles. Imagine gently stopping the flow of urine midstream or subtly preventing the passage of gas. The muscles you feel lifting inward and upward during that action are your pelvic floor muscles. Anatomically, they extend from the pubic bone to the tailbone. What matters most here is isolation. You should not be tightening your abdominal muscles, thighs, or gluteal muscles. The sensation should be internal, controlled, and upward, never forced. Once you can clearly identify and isolate these muscles, you are ready to begin. The entire routine takes no more than 3 minutes per day, and consistency is far more important than intensity. During the first minute, you will perform slow, controlled contractions. Gently lift the pelvic floor muscles and hold the contraction for 3 to 5 seconds, then fully relax for the same duration. This cycle should be repeated 10 to 12 times, with careful attention to complete relaxation between contractions. This phase builds endurance and neuromuscular control. In the second minute, you will focus on quick contractions. Rapidly contract and fully release the muscles in short, precise pulses, maintaining clean technique rather than speed. This phase improves reflexive strength, which is essential for achieving and maintaining firmness. During the third minute, you will perform endurance holds. Contract the muscles and hold the contraction for as long as is comfortably possible, initially 10 to 15 seconds, without holding your breath. Fully relax, then repeat this 3 to 4 times. This phase builds sustained strength and staying power. And that is the entire routine, 3 minutes a day. Now let me explain why this works, because this is where the underlying physiology becomes important. When most men think about erections, they focus almost exclusively on blood flow or testosterone levels. In reality, erections are the result of a coordinated interaction between blood vessels, nerves, and muscular control, and the pelvic floor muscles play a central role in that process. Two muscles in particular, the bulbocavernosus and ischiocavernosus, function as a natural pump. During an erection, blood enters the erectile tissue of the penis. For firmness to be maintained, that blood must remain there. When the pelvic floor muscles contract, they compress the veins responsible for allowing blood to exit the penis. This mechanism, known as venous occlusion, is essential for both firmness and duration. When these muscles are weak or poorly coordinated, blood escapes too quickly, resulting in erections that feel soft, unstable, or short-lived. As these muscles become stronger and more responsive, blood retention improves, leading to erections that are noticeably firmer and longer-lasting. In clinical practice, many men also report that erections feel easier to achieve, require less mental effort, and feel more stable once they occur, an effect that often improves confidence as much as physical performance. In addition, pelvic floor training enhances nerve sensitivity and neuromuscular coordination in the pelvic region. Improved signaling translates into better sensation, more predictable responsiveness, and greater overall control. While anatomical size does not change, many men describe erections that feel fuller, denser, and more dependable. The benefits extend beyond erectile function. A strong pelvic floor contributes to improved bladder control, reduced post-urination dribbling, and, in many cases, better control over ejaculation by enhancing muscular regulation during arousal. For this routine to be effective, technique is essential. Pushing downward, holding your breath, engaging surrounding muscles, or overtraining can all reduce effectiveness or create unnecessary strain. 3 minutes per day is sufficient. One important medical reminder should always be stated clearly. While pelvic floor exercises are powerful, they are not a replacement for medical evaluation. Persistent erectile dysfunction, pain, urinary symptoms, or sudden changes in sexual function should always be discussed with a qualified physician, as underlying conditions such as cardiovascular disease, diabetes, hormonal imbalances, or nerve damage may require direct medical treatment. Gentlemen, taking responsibility for your health, including sexual health, is not a weakness. It is a sign of awareness, discipline, and long-term self-respect. This simple 3-minute daily habit represents an investment in confidence, vitality, and quality of life. For best results, it should be combined with balanced nutrition, regular cardiovascular activity, adequate sleep, and effective stress management. If you found this information helpful, please like this video, subscribe to my channel, and turn on notifications so you don't miss future discussions. And finally, if you've already tried these exercises, or if you are just considering starting, I would genuinely value hearing your experience or your thoughts. Please feel free to leave a comment below. I read every message and I am always glad to respond. Stay informed, stay strong, and continue taking charge of your health.